Welcome to True Out Tuesday, and the truth will set you free. We're going to talk about cervical spine, and this is huge. Now, cervical spine is vitally important. I mean, you've got the skull, you've got these 7 bones here that are incredibly mobile and strong. The brain doesn't stop at the skull, it extends the top portion of the neck. So, what kind of things and all the nerves that supply the arm come out of the neck? So look at the majority of headaches, carpal tunnel syndrome, shoulder, rotator cuff problems, blood pressure issues, asthma, bursitis, neuropathy. All of these things can be contributing factors or causative factors from a cervical spine injury. Now, facts, 93% of all headaches come from the neck. So you should really get the neck checked if you have a headache. Now, about 7% of headaches are coming from toxicities. Dehydration is the most common, but alcohol and drugs are also huge contributing factors. And you're looking at less than 0.1% are from tumors or other causes. So you've got to identify the problem correctly. Now, when you're taking a side view of the neck called a lateral cervical, you got to have the hard palate in there, because if the head's down like this or up, you can obviously change the position of that cervical spine. And typically, I'm going to see a lot of medical x-rays that don't do this correctly. Now, the palate can move up and down as much as 15 degrees without affecting the curve in the neck. So you've got to have it assessed correctly. Now, also, when you look at this, past traumas, and this is going to be damage to that cervical spine, and this could be years ago, you can gauge the minimum amount of time that an injury occurred based on the amount of damage to the vertebrae and disc. Now, it takes 3 to 5 years to see a small bone change on x-ray, so you know the minimum amount of time that occurred from that happening. And if you see, say, grade 2 arthritis, that takes a minimum of 5 to 10 years to develop. Now, what's a trip is, so if you get somebody in an acute auto accident, their neck never hurt before, but you're seeing grade 2 arthritis, no, it means their body adapted to this. And by adapting, it means that the body is in a stress state. So it's vital to take a static x-ray and then to take a bending x-ray to show that you can get the problem corrected. Now, forward head posture. This is huge. The ear should be in line with the shoulder. For every 1 inch the head's forward, the pressure on the disc double. So if you're in a forward head carriage posture all day long, these muscles are going to be screaming to try and reposition that head. But also, what kind of things come from the neck? Remember, carpal tunnel syndrome, all of these. So this is why we don't recommend deep tissue massage of the neck for those neck spasms. You got to find out why they're spasming, because if these muscles are screaming to reposition the head and you relax them, which way does the head fall? Bam, further forward. So understand the muscles that run down either side of the spine. They're called postural muscles. Phasic muscles, arm and leg muscles, you can tighten and loosen, but postural muscles are going to increase in tone based on your perception of the environment or the position and motion of the vertebrae. Now, the curve in the neck is called the arc of life. Why? Because you've got the cardiac center at the top. You've got the nerve to the diaphragm in the middle. You've got the brachial plexus at the base of the spine. I mean, this is so vitally important. Now, the spinal cord itself isn't a collection of nerves. It's literally a long tubular brain, and there's no stretch fibers. So when that head gets pulled forward, the spinal cord literally pulls on that brain itself. And this is where you're going to get tremors on people that have lost a curve in the neck. Those tremors are designed to generate dopamine. So, and you're going to see when you get a patient with Parkinson's, massive forward head carriage, by correcting that forward head carriage, you're also going to see that some of the tremors start to diminish. The person gets better body control. So, and that's why it's insane to take medications to suppress those tremors without going after the cause. I mean, you have to do both if their person started on medications, but understand that body is trying to adapt to this toxic situation. You correct that curve and you decrease the physical stressor, and then the symptoms are going to be diminished. Now, it's hugely important that we check our children. Now, you're looking at over half of the births in this country now are done through C-section. C-section has 4 times the amount of pressure on a child's neck than a standard birth. And this is why we're seeing a massive rise in ear infections and asthma and breathing difficulties. Because what? You got the cardiac and respiratory center at the top of the neck. Now, here's 4 examples of kids. And we're seeing all abnormals, either a reverse curve, or reverse disc in the neck, twisted C1. We're looking at all sorts of these birth traumas. Now, if the kid has been born C-section, typically there's not an oxytocin let down, so it's hard for moms to produce breast milk. And if they're given the standard genetically modified commercially available formulas, it's not really good for the kid's development. That's why we recommend, if you can't produce your own milk, there's a lot of different formulas to keeping these kids healthy. But getting that kid checked for a physical stressor is going to be huge. Now, the brachial plexus, this is a nerve plexus that comes out of the base of the neck and supplies the entire upper extremity. Now, there's areas of skin called dermatomes, and this is skin supplied by a specific nerve root. And one of the most brilliant doctors that ever taught me was Dr. Jacobson. And he said, to find out what's wrong, you got to do 2 things. 1, you got to ask the patient, and 2, you've got to listen. Because patients will literally say, Doc, I get this pain coming right down to my thumb and finger. And you say, I know exactly what that is. That's the 6th cervical nerve root. Or, it comes right down here to my pinky. That's the 8th cervical nerve root. So I know that the neck is going to be involved. I mean, it's just so brilliant when you look at this, that the body is going to tell you where the problem is. Now, this system is so vital. This is why the central nervous system controls and coordinates every function of the body. That means that breathing, how your body produces and eliminates what produces proteins, eliminate waste products, processes nutrients, adapts to the environment, is all done by the central nervous system. Now, the brain's encased in the skull, but the spinal cord, which is a long tubular brain, is encased in mobile segments. Now, these segments have a huge amount of innervation because it's so important. So if you have a structural deviation, those muscles are going to be spasming out to correct the problem. There are also going to be alternate signals going up to that brain. So this is hugely important that we look at the physical and chemical stressors. Now, this brain, through this spinal cord, sends signals down to have the body adapt. Now, the brain controls the digestive function, but it also controls all the motory. Now, you've got 2 different things that come out. You've got motor impulses coming down. You got sensory input coming back. And if those signals are misinterpreted by the brain or alternate, then you're going to have abnormal function. This is why you've got to look at that brain's communication to that body, because the brain never does anything stupid. Now, we look at the cross-section of this cord. Now, when we're looking at people with severe damage, we're going to check for 3 different sensations: light touch, temperature, and vibration. Vibration is carried on the back half of the spinal cord. So if that cord gets knocked around from some structural deviation, okay, then if it's knocked around to the side, then temperature may be limited along a dermatomal pattern. And that's the area of skin supplied by a specific nerve root. If the back half of the spinal cord is damaged, then the vibration will be limited. If the front portion of the curve is damaged or cord is damaged, then light touch will be it'll be altered. So we check those 3 different aspects to find out where the part of the cord lesion is, or that cord damage is. Now, the cord is in the spinal canal. There's a lot of stuff in the spinal canal. You've got 3 different types of meninges or spinal cord coverings. The outside is called dura mater. Okay, and this has got its own blood supply. Now, the inner 2 layers, the arachnoid and pilator, arachnoid literally looks like a spider web, but these get their nutrients through cerebral spinal fluid. Now, that fluid is produced in the brain, and it flows down to give the cord nutrients. And so you can see why, if the cord is stretched, that could interrupt that flow of cerebral spinal fluid diminishing the nutrients to this long tubular brain, the spinal cord. So it's vitally important to make sure that curve and that cerebral spinal fluid is flowing correctly. Now, there's not a spot on your body that you can touch yourself and not feel something. So these nerves have such a fantastic distribution. And you've got the brain and the spinal cord encased in solid bone, and then the peripheral nerves go out. Now, peripheral nerves can regenerate fairly quickly, okay, if you have damage, but you've got to look at everything goes back to the central system and communicates to that brain. This is why looking at that center system, that structural, that spinal column itself is vital if you're looking at how the body's physiology is. Now, the cervical vertebrae are unique. They have holes in the side in the transverse process for the vertebral arteries. Now, all mammals have this, and this is why when you look at the neck of a whale, and I know there's not like a good separation, or the neck of a dolphin, these are mammals, and they have 7 cervical vertebrae, all with holes in the side for the vertebral artery. It's just, if you spend a lot of years in a human dissection lab, you're going to learn some odd things. Now, the muscles that run down either side of the spine are not under conscious control, but they're highly innervated, so that any sensory input that you get through movement is going to equate directly to that proprioception, or how the brain views the body in space, because these muscles are not under conscious control. So just to do a deep tissue massage on somebody with a structural deviation, you are not going to be helping them temporarily. But if you just think of this, if these muscles are trying to correct a problem and you relax them, which way is the head going to fall? Bam. So you got to identify what the problem is. Now, that parasympathetic nervous system, the rest, digest, and repair, this is responsible for your tissue production, for digestion, for neurotransmitter production, for adaptation, for producing healthy tissue. Half of it is located in the cervical spine. Half. So this is vital. This is why we call the neck the arc of life. If you have loss of curve or reverse curve, you're talking that cord is going to be pulled. You're altering the cardiac and respiratory center. You're putting that body in a chronic fight or flight state, and you're diminishing that cardiac and the parasympathetic nervous system, resting, digesting, and repairing. And you're looking at a normal curved neck and 2 patients with Parkinsonian's diagnosis. I mean, it's just crazy. Now look at this, reverse curve to normal. Okay, grade 2 arthritis to no arthritis. And what's interesting, you're going to see a lot of these x-rays, pre and post, are just within weeks of each other. I mean, we're doing 3 adjustments a day, separated by 90 minutes, giving exercises in between. Just know that your body gives symptoms for a reason. This patient here, 20 years of daily migraines. Okay, now the migraines started to diminish within the first week, but within the first 90 days, we're getting pre and post x-rays documenting that the spinal cord is under less pressure. Find the problem, fix it, and then make sure that you fixed it by doing a post x-ray to document that you're fixing the problem. Reverse curve to normal. Okay, now you can see on this film that there's diminished spacing in between the bones. Those discs are alive. You change the force loading on them, then you change the nutrients to that disc, and then the disc can regenerate. And remember, that curve in the neck is called the arc of life. You restore that curve, you're changing the force loading. For every 1 inch the head's forward, the pressure on the disc double. So all of these factors are taken in place in correcting that cervical spine. So when we talk about the importance of that cervical spine, the nervous system is the key. Resting, digesting, and repairing. The cardiac center. Double crush injuries such as rotator cuff problems, carpal tunnel syndrome, all of those, the cervical spine could be a contributing factor. Regular exercise. Now, we give ligamentous-based exercises to restore those discs, but also sitting. If you're sitting and your whole head's forward, you've got to have a ligamentous-based exercise to turn sitting into therapy. You'll see those on our lumbar health videos. And then proper nutrition. You're going to eat like your great-great-grandparents. Seasonal, healthy, organic, free of preservatives, as much as possible, and seasonal. I mean, just fantastic, normal food. But then at nighttime is when your body regenerates. That's why sufficient rest is so gosh darn important. And then prayer and meditation. Prayer and meditation is the key. This is going to be every study involving prayer. Why? Because you're in that moment of parasympathetic. You're focusing in on something greater than yourself. You have a connection with your creator. It works every time. This is Dr. John Bergman. God bless you all. Stay healthy, my friends. Now, make sure you put your questions and below. We're going to be dividing the questions up for the cervical spine video on two different parts, censored and uncensored. The censored comments we're going to be putting back up here. The uncensored ones are going to be on our sites, our private sites, because there's a lot of things that we can't talk about in the standard media. That's how the world is now. So just put your questions down below, and I'll get to as many as I can. But they are going to be divided into what I can talk about, and what I can't talk about is going to be put on our private site. God bless you all. Stay healthy, my friends.